Welcome to Raaonline. I'm Dr. Kalaivani Ramalinga. I'm an obstetrician and gynecologist with a special interest in urogynecology. I work in United Kingdom with the Channel Islands in Princess Elizabeth Hospital, Guernsey. My area of interest is particularly pelvic floor disorders and urinary and bowel incontinence. So today I'm very happy to be presenting for this platform, Urinary incontinence in women. We will find out about assessment of urinary incontinence in women. So the specialty of urogynecology deals with any women with pelvic floor disorders. It's about performing reconstructive surgery in people who have damaged pelvic floor, treating various bladder conditions such as urinary incontinence, treatment of bowel problems which are associated with the pelvic floor problems. We also treat people with prolapse of the uterus and the vagina and any problems with sexual dysfunction. Now, having said that, we will focus on today's topic. What is urinary incontinence? The involuntary loss of urine, which is objectively demonstrable, or when it becomes a hygiene problem, is defined as urinary incontinence, or simply put, loss of urine when it's not meant to happen. So it can be a social and a hygiene problem, and that can mean an awful lot to a person in terms of activity of their daily life. Now, how prevalent is it, or how common is it to find this problem in women? It's very variable, various studies depending on which age group you're looking at. It varies between 1 to 11% of all women. It's difficult to report from population data because it's not something that people come forward for treatment immediately. And for this reason, it's difficult to get huge population data because it's quite an intrusive question to ask somebody this question. Now, with the available data, this shows us the prevalence with the age-wise distribution, with the mild, moderate, and severe ends, and the unquantified urinary incontinence. You can see it's a double humped increase. The first peak incidence, about 30% of women having urinary incontinence, occurs in the age group around menopause, which is around the 50s. And you have another peak, about 35% of women in the age over 85. Now, if you see, it's not non-existent in the younger age group. It's still about 10% of women have problems with urinary incontinence, even as early as 20 to 25 years of age. So it varies between 1 in 5 women when you're age 20 to, when you look at an incidence of 33%, 1 in 3 women at the age of 80 or over. So it is a very common problem and a well-prevalent problem that needs more attention. So what are the types of urinary incontinence that we are aware of? The one is the stress incontinence, which is the leakage of urine when you cough, sneeze, or when you're performing any activities of lifting when you put pressure on the pelvic floor. So that's stress or the effect of the weight on the pelvic floor. The second type, which is the common type, is the urge incontinence, which is often due to overactive bladder, when the detrusor contractions of the bladder happen when it is not meant to, because normally you have a detrusor contraction only when you are emptying your bladder. So this unregulated contractions cause an urgency and frequency of urine along with leakage, which is called an overactive bladder. Now you can have a combination of these two with stress incontinence as well as urge incontinence called mixed urinary incontinence. And two other causes of urinary incontinence, one which is very common is urinary tract infection, and one which is rare but very serious is a fistula, where there is a communication between the urinary tract and the vagina, which causes the urinary leakage. Now, can there be temporary or reversible causes of urinary incontinence? Yes, there are. So in a person who is acutely ill or has delirium for any reason, so they don't have the higher centers to dictate the urinary continence. So delirium is a cause of temporary incontinence. If somebody has restricted mobility, if you have a broken limb, if you're not able to walk because of a fractured leg, if you can't get to the toilet quick enough, that can be a reason. And in the older age, restricted mobility because of arthritis or other reasons can also mean that with a normal functioning bladder, you cannot get to the toilet quick enough to empty your bladder. Urinary tract infection, as we have already said, and also fecal impaction can be another reason for urinary incontinence. Polyuria or increased production of urine for any reason, the most common being diabetes mellitus, can be a reason why you have temporary incontinence. So the small mnemonic drip for delirium, restricted mobility, infection or impaction, and polyuria helps us to exclude reversible causes of incontinence, where there may not be anything particularly wrong with the bladder, but the overwhelming nature of this intervening problem which causes the incontinence.